This medical gadget could save a life or cause a disaster if you don't know exactly how to use it. I've seen it firsthand as a combat medic. The biggest risk isn't the gear, it's the gap in medical know-how. I'm a former 160th SOAR flight medic, current nurse practitioner, and author of My Journey as a Combat Medic. I've used most of these 27 medical tools in real emergencies, both in combat zones and in the States. The truth is, the tools themselves aren't dangerous. Lack of training is. You can order all this gear online, but if you don't understand how and when to use it, you could make a bad situation much worse. Number 27, urine test strips. Let's kick things off with something you might find in any medicine cabinet. These strips test for everything from glucose to protein. The problem? You're not a doctor. Twisting your head sideways trying to interpret that little colored square could send you down a rabbit hole of anxiety over nothing, or worse, make you brush off a serious kidney infection because you thought you were in the clear. Number 26, blood typing kits. Ever been curious about your blood type? For just a few bucks, this kit promises to reveal all. You prick your finger, mix it on a card, and voila. But if you get the agglutination, the clumping of blood wrong, you're in for a nasty surprise. Thinking you're O positive when you're really B negative is a fatal error just waiting to happen in a real emergency. Number 25, trauma shears. The iconic tool of every first responder, designed to slice through denim, seat belts, and leather. You can own a pair for less than the cost of a pizza. The danger isn't the shears themselves, but the person holding them. In a panic, it's frighteningly easy to jab the person you're trying to save. Or you might use non-sterile shears too close to a wound, basically giving nasty bacteria a VIP pass into the body. I learned early as a flight medic, even the right tool can cause harm if you don't know the proper technique. Number 24, ENT otoscope. This device lets you play doctor by peering into someone's ear canal. It seems like a great way to check for earwax or see what's causing an earache. But the ear canal is incredibly delicate. One little slip and you can scrape the canal, causing bleeding and infection, or even puncture the eardrum and cause permanent hearing loss. Number 23, suture practice kits. Marketed to med students, these kits have everything: a fake skin pad, needle driver, forceps, and sutures. The catch is, anyone can buy them. They offer a dangerous dose of confidence, tempting amateurs to try stitching up a cut on themselves, a buddy, or even a pet, without proper sterile technique. That's a one-way ticket to a horrifying infection and some really ugly scars. Number 22, dental surgery kits. Speaking of DIY disasters, how about a little home dentistry? These kits are actually sold for personal use and include razor-sharp scalers, probes, and sometimes even extraction forceps. Trying to scrape your own plaque is a great way to destroy your enamel. Trying to pull your own tooth is pure madness. You risk fracturing it, causing a massive infection, or creating permanent nerve damage. Number 21, Guedel Airways. This curved piece of plastic is an oral airway designed to keep an unconscious person's tongue from blocking their throat. It's a literal lifesaver in the right hands. But there's a reason they come in so many sizes. Use one that's too big and you can block the airway completely. Too small? You'll just push the tongue back and make things worse. You could also trigger vomiting, causing the person to aspirate. Number 20, ambu bags. You've seen these in every medical drama. An ambu bag is a manual resuscitator used to breathe for someone. Squeeze the bag, air goes in. Simple, right? Absolutely not. Squeeze too hard or too fast, and you can overinflate and damage the lungs. Don't get a perfect seal around the mouth, and no air gets in at all. Getting the rhythm and pressure just right takes a ton of training. In SOAR, we drilled airway management relentlessly. It's not just about owning the tool, it's about mastering it. Number 19, manual suction units. When someone's airway is full of fluid, this hand-powered pump is used to clear it out. It's a portable, non-electric lifesaver, but in untrained hands, it's practically a weapon. Jamming the catheter in too deep can cause serious tissue trauma and bleeding. Suctioning for too long can suck all the oxygen out, along with the fluid, a condition called hypoxia. Number 18, cervical collars. We've all seen these neck braces at car accidents used to stabilize the spine. But putting one on isn't as simple as it looks. If you apply it incorrectly, you can actually make a spinal injury worse. A poorly fitted collar can also restrict breathing or increase pressure inside the skull, turning a precaution into a direct threat. Number 17, Skedco litter. This is a pro-level rescue stretcher that wraps around a patient so they can be hoisted out of tight spots. It's brilliant tech. But if you don't secure the patient perfectly, especially someone with a suspected neck or back injury, every single bump and jostle on the way out can cause more damage. Number 16, surgical skin staplers. This feels like the ultimate first aid hack, a gadget that closes a wound with one quick squeeze. It's definitely faster than sutures, but if you mess up the alignment, you're left with a poorly closed wound that's begging for an infection and a nasty scar. Worse, staple too deep, and you can hit a nerve. Even the pros are extremely careful with these. Number 15, Celox applicators. This is a syringe-like device you inject into a deep wound to stop a major bleed. It's straight out of a battlefield medic's kit, but if you don't apply it with enough pressure or you miss the actual source of the bleeding, it's useless. Plus, the chemical reaction that stops the bleed can cause burns if you don't use it correctly. I've used hemostatic agents in combat. Application technique is everything. Good gear, wrong method, bad outcome. Number 14, combat tourniquets. A tourniquet can stop catastrophic bleeding from a limb and absolutely save a life. But there's a reason it's a tool of last resort. Apply it when it's not truly needed, and you can cut off blood flow, causing permanent muscle and nerve damage. Leave it on too long, and the limb might need to be amputated. There is absolutely no room for error here. Number 13, traction splints for femur fractures. Breaking your femur, the biggest bone in your body, is a massive medical emergency. The splint is designed to pull on the leg to realign the bone and ease the pain. But if an untrained person puts it on, they can easily pull way too hard, separating the bone even more and tearing muscles, blood vessels, and nerves in the process. Number 12, junctional emergency bleeding tools. What about a serious bleed where you can't use a tourniquet, like in the groin or neck? That's where tools like the IT clamp come in, literally clamping the wound shut. But if you place it incorrectly on the neck, you could easily block an airway or compress a vital artery. It's an extreme tool for an extreme situation that demands precise knowledge of human anatomy. As a nurse practitioner and medic, number 11, minor surgery sets. All right, we are now entering some truly terrifying territory. If you're finding this peek into the hidden dangers of online shopping fascinating, do me a quick favor and hit that subscribe button. We're about to count down the top 10, and trust me, you don't want to miss what's coming up. Now for number 11, you can buy a full minor surgery set. I'm talking scalpels, forceps, hemostats, scissors, real surgical instruments. The fantasy is performing a clean, simple procedure. The reality for an untrained person is infection, uncontrollable bleeding, nerve damage, and turning a tiny problem into a life-altering disaster. Number 10, IV supplies. You can buy everything you need to start an IV line on Amazon. People buy them for everything from bogus hangover cures to vitamin infusions. But without sterile technique, you're just mainlining bacteria into your bloodstream, which can lead to sepsis. And if you really mess up and push air into the vein, an air embolism can travel to your heart or brain and kill you. I've seen infections and complications from improper IVs that are far worse than the original injury. Number 9, oxygen supplies. You can buy oxygen concentrators and even small tanks online. But oxygen is a prescription medicine, and like any medicine, the dose matters. Too much oxygen over time can become toxic to the lungs. The most immediate danger, though, oxygen is an oxidizer that makes things burn violently. Any spark in an oxygen-rich environment can lead to a raging fire. Number 8, advanced pre-packed medical bags. These come stuffed with not just bandages, but advanced tools like chest seals and tourniquets. The biggest danger here is the false sense of competence they give you. Owning a tool doesn't mean you know how to use it. In a real emergency, fumbling with a tool you don't understand wastes precious time and can actively cause harm. Number 7, chest decompression needles. This is a very large needle used to puncture the chest wall and relieve a collapsed lung. It also requires knowing the exact spot on the chest to stick it. If you're off by an inch, you can puncture the lung, the heart, or a major artery, killing the patient on the spot. Number 6, tracheostomy sets. A tracheostomy is a surgical procedure where you cut a hole in someone's neck and insert a tube to create an airway. The fact that a complete kit for this can be delivered to your door is mind-boggling. This is not first aid, this is surgery. One wrong move means catastrophic bleeding or permanent damage to the trachea. Number 5, chest tubes and insertion sets. Similar to the decompression needle, a chest tube is inserted into the chest cavity to drain blood or air over a longer time. For an amateur, the list of things that can go wrong is horrifying. Puncturing the lung, the heart, the diaphragm, or the liver. Number 4, portable emergency ventilators. A portable ventilator is a machine that literally breathes for the patient. Setting the breath rate, volume, or pressure incorrectly can cause severe, irreversible lung damage or just fail to provide enough oxygen to live. Number 3, the IT clamp. This powerful device clamps a wound shut with incredible force. Used incorrectly on the neck, it can crush the windpipe. Used on a limb, placing it wrong can fail to stop the bleed while simultaneously destroying all the surrounding tissue. Number 2, intubation kits. Now, this is the big one from all the medical shows, placing a breathing tube down a patient's throat. But intubation is a violent, difficult procedure, even for the most experienced doctors. It's easy to break teeth, damage vocal cords, or put the tube into the esophagus instead of the trachea, pumping air into the stomach while the patient suffocates. Number 1, the full DIY trauma kit. Our number 1 spot isn't a single tool, but the fact that you can combine all of these items into your own personalized, home-delivered trauma bay of horrors. The single deadliest thing you can buy is the illusion that owning these tools makes you a doctor. It doesn't. It just gives you more ways to cause irreparable harm. The most dangerous thing in any medical emergency isn't the injury. It's someone with good intentions, but inadequate training, making irreversible mistakes. So that's the reality. 27 medical tools that could mean the difference between saving a life and causing a tragedy, all just a click away. As someone who's used this gear on real battlefields and in real emergencies, I can tell you the real danger isn't the equipment, it's the converse gap between owning it and actually knowing how to use it. The scariest prepper isn't the one with no gear. It's the one with a trauma kit and zero real-world training. Every item I showed today can be life-saving in the right hands or catastrophic in the wrong ones. If you want to be truly prepared, don't just fill your bag, fill your mind. I've linked proper training resources and the gear I actually recommend down below, so you can get started the right way. If this opened your eyes, smash that like, subscribe for more no-nonsense medical prepping advice from someone who's actually used this stuff under fire. And check out my book, My Journey as a Combat Medic, in the description. Now I want to hear from you. What's the most dangerous or over-the-top medical gadget you've seen for sale online? Drop it in the comments. I read everyone. Stay safe, stay trained, and I'll see you in the next one.